back to our second segment video for spinal injuries. If you're new here, I'm Dr. Jay Bowen at New Jersey Regenerative Institute, with the hope of treating your pain with non-surgical regenerative medicine. Now, low back pain may show up in lots of ways, but when it starts traveling down your leg, there's a good chance you're dealing with a pinched nerve. Some people call it sciatica, but it's not exactly correct. So, for our second back problem explained, I'll be talking about a pinched nerve. When people talk about a pinched nerve, they're often describing something called a radiculopathy, and it can be one of the more painful forms of spine-related symptoms. Your spine naturally has this curve, it's C-shaped, and it's called lordosis, so that the spine has this kind of positioning. When that curve gets lost or straightened from poor posture or chronic tension, the load on the spine shifts and increases. Instead of the weight being evenly distributed, more pressure builds on the front of the discs, and over time can start to stress the inner material and cause it to be pushed backwards. That's when people get what's called a slip disc, or more accurately, a disc herniation. And here are things that get tricky. Right next to those discs are the nerves that exit the spine and run down your legs. And unfortunately, they're in a confined space that's bony, and so when that soft disc presses, it can be quite painful. So the disc material presses on those nerves, and you feel the shooting pain down your leg, even if your back feels totally fine. This is a radiculopathy. And depending on what part of the nerve is compressed, you might also get numbness or tingling or even weakness in your leg and foot. Now, the good news, most of these cases can be treated without surgery. The main goal is to manage your pain while you start to heal. In fact, a study compared surgery to no surgery for disc herniations. The surgical group got better faster, but at 1 year, both groups were pretty much the same, with a slight edge for the non-surgical group. If you have muscle weakness, though, especially in your leg, it's called a red flag sign. Other important changes to watch out for are loss of bowel or bladder function, meaning you can't pee or you can't poop, or it happens and you don't even realize it. These require urgent medical evaluation, and surgery might be necessary to prevent long-term nerve damage. The good news is these are pretty rare occurrences. Loss of spinal curve causes disc overload. Herniated disc may compress on a nerve that's nearby, causing pain down the leg, and that's called a radiculopathy. Most easy with surgery. But if weakness or problems with peeing or pooping happen, seek medical attention ASAP. If you're feeling nerve pain, don't panic. There are options, and most people get better. As always, early intervention and the right posture can go a long way. The usual treatment for disc herniation starts with simple relative rest, but not too much. Let pain be your guide. Also, medication and physical therapy. But if the pain is not letting up, I would consider an epidural injection to reduce the pain from the inflammation around the nerve. Now, there's a second common cause of pinched nerves called stenosis, and that just means narrowing. In most cases, if you hear your healthcare provider say stenosis, it comes from arthritis, which are bony changes that crowd the space where the nerve lives. Although chronic degeneration with ligament thickening and disc bulging can contribute. Treatment is trickier because you may be dealing with these more solid structures, not just soft tissues. And as you can see in the spine model, you have a bone or vertebral body above and below, making a half circle and a half circle that form the exit for the nerve root. And if these get arthritic and narrowed, or there's other degeneration, you can see how that can pinch and compromise your nerve that goes down your leg. Well, generally for this problem, we'll start with some medications and physical therapy, as well as epidural injections, as I mentioned. But if nothing's working, surgery may be needed to physically remove some of the bone and open up that space I talked about. The problem, sometimes removing too much bone makes the spine unstable, and then we're looking at a fusion to hold everything in place. Epidural injections usually involve a corticosteroid, which is a strong pharmaceutical anti-inflammatory. But there's a catch. We limit the amount of steroids we give people every year to about 3. Why? Well, because steroids can weaken bone, and in one study, we found even one steroid injection for this type of problem worsened osteoporosis in postmenopausal women. So we want to be very careful. So, instead of steroids, we can use something called platelet-rich plasma, or PRP. It's the same injection technique, but this time using healing factors from your own blood instead of cortisone. PRP doesn't carry the same risks as steroids, like increasing your blood sugar or blood pressure, so it can be used more frequently. And beyond nerve pain, it can help strengthen the ligaments that support the spine, which can be part of the problem, and this can be included in the injection procedure technique. In cases where structure and support both matter, regenerative options like PRP could make all the difference. Join us next time as we break down degeneration, also known as lumbar spondylosis. This is a commonly missed source of low back pain.